A lot of you want to know more about the variant and some of the initial observations about it. While all variants are concerning, Dr. Ronald Grifka, Chief Medical Officer with U of M Health West, says there are some promising initial takeaways.
I know we all were very busy and happy and excited to see family, but it is still very concerning, a very difficult time. We are still in this pandemic.
We thought, but we're hoping to be through the pandemic now, but certainly with the Delta variant, we're right in the middle of it. And our hospital has had the highest census of COVID patients ever during the last week. And speaking to my colleagues at the other two hospitals, they're certainly in the same situation as we are. So COVID is rampant. We're certainly taking care of many, many patients, and some of them are quite ill.
And you mentioned the Delta variant, but now we're focused on the Omicron variant. So why is this different, and why is it something to be concerned about?
Sure. The Omicron variant is quite interesting. It has 25 or 30 different mutations. So sometimes the variant may have one or two, but this one seems to have 25 or 30, which makes it a little concerning. That could these number of different variations cause an issue and maybe not as good of a robust response with our immunizations and antibodies. So that certainly has got a lot of attention over the last several days even.
What are some of the symptoms that we should look out for? Is there any way to know that we have this variant?
The good news is that the same symptoms as regular COVID or Alpha or Delta, cough, fever, chills, loss of sense of smell and taste. So really the symptoms are no different. And again, there's been a lot of talk about Omicron, but really not much data has been noted about it so far. So we're certainly just starting to look into the Omicron variant and seeing what its effects are going to be on the community.
And you mentioned those vaccines too. We still don't know if these vaccines will work.
Good question. We don't know that yet, but certainly we're just starting to look at it this week. It's been just a very soon since it's been noted, the Omicron variant. But certainly we've seen with other variants, the vaccines have been quite effective. And even though there's more variations in this type of the Omicron, we suspect that the vaccines probably will have good antibody response, because antibodies are a B cell type of response, but there's also T cells. And we do feel pretty good that they will have a good response from our present vaccinations with the Omicron variant.
That is really good news. And of course, more people who are vaccinated, the better.
Right. And certainly when viruses mutate, the next mutation tends to be a little less infectious and a little less severe. Now, Delta obviously didn't follow that pattern. It was a little more infectious, a little more severe. But so we'll see what happens with Omicron. But anytime a person gets infected, the virus is duplicating itself in our body. If we're vaccinated, it kills the virus. We don't duplicate it. So the more people we get vaccinated, the less variants we'll have, the sooner we'll get out of this pandemic and get back to what we all want, a normal life.
Yeah, and you mentioned just how completely overwhelmed all of the hospitals are. How are you guys holding up? How are you doing?
Certainly, the last several weeks have been a challenge. And with most of this is like our fourth surge now with COVID. With the previous three surges, there was a rather quick spike in the numbers, and then they dropped. This one's been dragging on quite long, longer than any of us had expected, and certainly even longer than any other cities or countries in the world have had it. So it really is prolonging the agony, if you will. It's stressing out the nursing staff, the assistants, the therapists. Many people in the medical profession are just really at wit's end because of the length and the duration and the severity of illness with this Delta variant.
Yeah, at your wit's end, and I would imagine frustrated that it's still happening.
This is certainly, we were hoping again, it was a little peak and it would drop off. We're not seeing that, and it just continues on and on. And the vast majority of the people who have been admitted to the hospital have been non-vaccinated, and they're the ones who certainly are getting the most ill symptoms. So again, just stress, it's important not just to get your vaccination, but also if you're eligible for a booster, the data with the third shot really shows much less infections rate, like 92% less chance of becoming severely ill or hospitalized if you did get the booster. So please, if you have been vaccinated, please get vaccinated. And if you have, let's get your booster to make you as safe as possible, keep you out of the hospital, keep your family safe also.
All right, good. Great advice as always. Well, thank you so much for all of your hard work. We really appreciate it.
Thank you. Be well. And a lot of the medical community is doing a great job trying to get us through this, and bear with us, but we'll get through there.